All right. Good afternoon, everyone. Thanks for joining our webinar today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY campaign. I have to say that I was really excited for it to finally be March today, now that February's brutal ice storms, the snowstorms are behind us, and then the flooding happened, and I just don't exactly know what to say. Kara has been sending me photos of her hometown of Martin in Eastern Kentucky, and it looks really scary. So if you're joining us from an area with severe flooding, I hope that you and your family are safe. And it feels like we just have one crisis on top of another right now, and it really goes to show just how much we need a strong safety net. One good thing that we can say about March is that this is the last month of the General Assembly for 2021. We are finally more than halfway through. Between the legislative session, the federal relief bill moving through Congress, and COVID-19 vaccines ramping up, there's a lot happening in March. And as always, our goal with these briefings is to make sure that you get the latest information on the state and federal response to COVID-19, updates on our safety net programs, and learn about opportunities to advocate and educate. So we'll focus on what's changed since our last webinar and things that we're anticipating for the future. And I think by now, many of you are familiar. I'm trying to advance. Oh, I'm not advancing the slides. Kelly, can you move the slide forward? That would be the problem. I think many of you are familiar with the ThriveKY campaign by now, but our core purpose is to meet the basic needs of every Kentuckian through systemic change. You can see our shared principles on this slide. And if you advance to the next slide, you'll see the members, our partners of ThriveKY. And then let's go ahead to the next slide. Here's the agenda that we're going to be covering this afternoon, with each of our ThriveKY partners presenting on their areas of expertise. Before we begin, I'll just do some quick housekeeping. We have a lot of folks on the webinar today. I think some are still coming in. Please just be sure to mute your line. We're also recording this webinar. We'll be sending out the recording with the slide deck and any other materials that people discussed today in a follow-up email tomorrow. And as speakers are presenting, you can use the chat box to ask questions or make comments. We'll try to cover those as we go. And finally, if you're a certified community health worker or a licensed social worker and want to receive credit for today's webinar, please email me or Kelly. Speaking of emailing us, you may not want to do that immediately because our email has been down today. Our website is also down. I think that those things will be resolved soon, but it's been an interesting morning here. So with that, I'm going to turn it over to Dr. Sheila Schuster to give us an update on the 2021 General Assembly.
Thank you so much, Emily, and good afternoon to you all. Like Emily, I hope those of you who are suffering with the flooding and those of you who were suffering with power outages and so forth are safe and warm and healthy. We are 2/3 of the way through the General Assembly. This is a short session. And we reported in our January webinar that they would meet early in January for what they call Part 1. It usually is just 4 days that they do mostly ceremonial kinds of things, elections of leadership and ethics training and swearing in new legislators and so forth. But this time they added 4 days to it. They even worked on a Saturday. And so they took 8 of the 30 days rather than 4 of the 30 days, which is really compressed, to put it mildly, the Part 2 of the session. You all probably followed some of those things that were going on during that Part 1. There were bills that were passed that stripped the governor of most of his emergency powers. They retracted all of the emergency regulations that were passed in 2020. And just to remind you that the legislature passes the statutes, which gives the executive branch the ability to do regulations. And I call the statutes framing the house, but you can't live in it. And the regulations are what makes it livable. So they do all the crossing the T's and dotting the I's and putting the flooring and the electricity in and so forth. So the regs are very, very important because that really tells you how the legislator's intent in the statute is going to be carried out. 6 of those 7 bills were vetoed by the governor. And when they came back at the very first part of the part 2 of the session on February 2nd, they immediately overrode. They do that by a simple majority in the House and Senate, all of those vetoes. So 2 of the bills have been appealed by the governor to Franklin Circuit Court for injunctive relief. And they are bills that have to do with, again, COVID-related openings of schools and nursing homes and businesses and so forth. So they're waiting for the Judge Shepard of the Franklin Circuit Court to issue a ruling on whether they are constitutional or not, is basically the question being asked. So the other thing that's odd about this odd year session is that it's a budget year, which hardly ever happens in a short session. I might remind you that when they met in 2020, which would have been the biennial or 2-year budget, they decided not to do a second fiscal year budget because they really didn't know how to predict the impact of COVID and the impact of businesses not being open and not paying taxes and so forth. So we're in a budget year. The governor released his budget in that part 1, and it was a very positive budget from a fiscal standpoint. And I think for those of us who worry about cuts in bad times, and we've had cuts so often to Medicaid, to mental health. I'm a licensed psychologist, so I always follow that closely. We've had rollbacks in the retirement system and so forth. So his budget was very positive. It had no cuts in it for Medicaid, education, and those major programs. Also had a bonus for teachers and pay raises for state employees. However, and if you could go to the next slide for me, please, Kelly. The state's pension system continues to be just a huge problem. And we have several pension systems in the state. We have KERS, which is the state employees. We have KTRS, which is the teachers' retirement. And then we have CERS, which is the county and city retirement system. And all of them, more or less over the years, have been poorly funded or poor decisions have been made about investments. And many times the legislature did not put into the budget their share of those retirement costs. But our quasi-governmental agencies like the community mental health centers and the rape crisis centers, domestic violence shelters, and children's advocacy centers were paying their fair share. And now push has come to shove, and there are lots of questions about what's going to happen next with the pension system. There is a bill that looks like it has legs that would redo the teachers' retirement system for incoming or new teachers, not affect what's the teachers that are there now. And the other bill is House Bill 8, which has passed the House and is over in the Senate. And it would completely change the way that the liability is figured for those quasi-governmental agencies. And there are some agencies like, again, the domestic violence shelters and rape crisis centers that actually will have less to pay under that bill. So of course they're in favor of it, which I would be too if I were working there, but the CMHCs are hard hit by that. So we're looking for additional funding in the budget to make the community mental health centers whole in this budget. We only have 10 legislative days remaining. We're a week later in the calendar. So if you're confused about the calendar, it's because it's been changed probably 5 times for this session. They called off the session altogether 2 weeks ago when we had the ice and snow and so forth. And even the LRC staff, the Legislative Research Commission staff, did not come into work. In fact, if you tried to call the message line, you got a message that said, we're using an answering machine, so leave your message and we'll transcribe it and get it to the legislators. First time I've ever known that to happen. We've had nearly 900 bills filed, so the legislators have been busy, almost 600 in the House and almost 300 in the Senate. We are past the filing deadline, so we're not going to get any more. But think about this. They passed 7 bills in that first period in January, and they've actually only sent 2 other bills to the governor's desk. So there's a huge backlog of action still to be taken. And Kelly, if we could go to the next slide, I'd like to go over some of those bills. So some of the things that are moving, and these by and large are things that various organizations in the ThriveKY group have been advocating for. One is what we call insurance parity or equality between the way insurers and Medicaid handle mental health and substance use disorders and physical health. So they can't charge a higher copay or higher deductible. They can't put a lower annual or lifetime limit. They can't put caps on numbers of days in the hospital or numbers of visits if they're not there on the physical health side. So we want mental health and substance use disorders to be treated as brain disorders, which is really what they are. We're very excited. That's House Bill 50. We're very excited about House Bill 140, which would make permanent some of the telehealth rules that have been in effect during this emergency period. And I suspect that some of you who are attending the webinar have seen your health provider or your mental health provider via computer, perhaps even on your smartphone, or in times of crisis, even by telephone. And we think that this is a good way to overcome some of the transportation issues that we have and some of the lack of providers that we have in some areas of the state. So this is a very good bill. Our groups have been working for years to eliminate Medicaid co-pays, and there actually is a statute that requires them. So Senate Bill 55 would eliminate the Medicaid co-pays, and it has passed the Senate and is over on the House side. For several years, there's been bipartisan support of a bill that would put a cap on insulin prices, and that's getting some movement in the House. We also are working on a bill that would help with the cost of expensive medications. That's Senate Bill 45, and that has come out of the Senate and is now over in the House. And then you've heard a lot about Breonna Taylor, of course, in Louisville, and the restrictions on no-knock warrants, and that bill just came out of the Senate. That's Senate Bill 4. There are some things that we've been advocating for that are not moving. The surprise billing, which is what happens to you when you do your homework and you pick a surgeon that's in your network and you pick a hospital in your network, and then you have your surgery, and when you get home, you get this big bill from the anesthesiologist or the radiologist or the pathologist, and you had no choice about who those people were. And we want to hold the consumer harmless in that situation and have the hospital, the insurers, and the providers work that out. There have been a number of bills on data collection on health disparities. One of the things that's come out of the COVID pandemic is that our Black and Brown communities have differential effects, more negative effects from the COVID virus because they don't have the access to health care. And some very simple bills to at least begin to look at the demographic features of that have unfortunately not moved. There have been some bills around racial injustice. There is a task force that has come out of the Senate, but some of the other more progressive bills have not passed. There's a whole slew of bills that the House Democratic Women's Caucus has put forward. I think there's 15 bills in that group around maternal and infant health. So far, only one of those bills, House Bill 294, is moving, and that would provide information on postpartum depression. We've worked for years to get rid of corporal punishment in the schools because we know it is not only not good for kids, it's actually harmful, and it doesn't result in the behavior change that people think that it does. And that bill has not even been assigned to committee. And then the restoration of felon voter rights we have worked on for 20 years probably, and are still working on that, and it's not moving. So the final thing I want to draw your attention to, as you already know, is that there have been changes in the rules in the House and Senate. So a lot of bills never even got assigned to a committee. So they've had no life because a very small group of legislators looked at them and decided they were not worthy of a hearing. And that I think is a real problem. And a number of those bills are sponsored by Democrats. They are in a tiny minority in both the House and the Senate, and their bills have not been given, I think, a fair shake in either the House or the Senate. So the final thing I want to draw your attention to is we did press on legislature around some access rules. If you could go to the next slide, please, Kelly. The Capitol buildings are essentially closed to visitors, but you can make an appointment with a legislator and you will be admitted just for that time. And we have an access guide. The link is there that we update with any changes in that. And then we kept asking, and finally they came up with a way for you to register to testify, particularly if you want to oppose a bill. If you were in the legislature, you could walk up on the day of the hearing and sign in and say, I want to testify against Bill, 9999. And if there's time in the committee, they would have called you to the table. But this allows you, and I appreciate Kelly making it so easy to follow. So you go to the website, legislature.ky.gov, you click on committees, and then you go down to live coverage, and under that is a request to testify. So they'll ask you for your contact information. They'll ask which side you're on, pro or con. And they do ask for a very brief discussion of what points you want to make, which worries me a little bit that they would invite maybe some people to testify and not others. But I have filled out the form and been invited to testify, actually. So I know it does work. So I'm going to stop at this point. And if you have any questions, please put them in the chat. Thank you to Kelly for her nifty little Venn diagram here, or workflow diagram, I should say. And I'm going to turn it over to Kara Stewart with Kentucky Voices for Health, who's going to talk about federal relief. Take it away, Kara.
And just like every month, when I think we're not going to have anything to talk about with federal relief, we do. Something happens. So in case you were awake at about 2:30 in the morning, Friday night, Saturday morning, the House passed a COVID relief bill. So what we talked about last month and asking for happened over the weekend. And I took out all of the iterations and put them all into one little bubble on here, the ones that say it never became law, because obviously we've had a bunch of fits and starts and almost bills. And we've actually had 2 become law, and a third one that has now passed the House that we expect will in some form or fashion pass the Senate. So I'm sure you probably heard $1.9 trillion, but we can go into some of where that money goes. Kelly, we can leave them a pretty slide and go to the boring slide. I meant to try to make them all prettier, but we just got the one pretty one. Apologies. So there was a lot of details. The really, I think, good news I tried to pull out was the direct assistance to individual families of things I think will mean something to a lot of people, which is in the House bill, there is a $15 minimum wage. Of course, I'm sure everyone at this meeting knows that's probably not going to become law because the parliamentarian in the Senate said that it doesn't matter. It probably won't become law to this bill. But most of the other stuff I hope can and will, which includes $1,400 relief checks for most Americans. And we're looking like, 90+%. So if you've ever gotten one before, you're probably going to get it again. It does tap out, but it starts to break off at $150,000 for a household. But it includes children at that same level. There is a significant number of people that haven't gotten their second relief check because they haven't filed their 2020 taxes. So if you're out here, ask people about that, because a lot of people who've said, I didn't get my relief check and they need to file their taxes, which they can still do, no big deal. But the number out there was surprising to me. And it expands the child tax credit to $3,000 per child and $3,600 for children under 6. That's good. It's not enough. We need money to be going to parents every month because children are expensive. So we need to be encouraging people to be able to take care of their children, making it possible. That's just my personal tip there. And it expands also the federal bump in unemployment, since of course unemployment is not the same amount people make in real life and is not enough people to live on. And we're going to talk more about that. Justin's going to have some more about that. It bumps that up to a $400 extra and extends it until August. So we have moved basically all of the March dates got moved to August. So this is another like not creating a trigger, not guaranteeing that if something really bad goes wrong, we have a fix in place. This doesn't do any of that. It basically extends most of the same things we've done before to August, which is good, but not as good as creating triggers and permanent solutions for any time something like this happens. So just kind of want to keep that in perspective. It does have the max SNAP benefit increase, that 15%, that's in there. Also good news. And then there's also a bunch of some housing money that Adrian's going to talk about later. And of course, like I've already mentioned, Kelly, we can go to the next slide. I've already mentioned the deal now is we need it to be passed the Senate. And I'm sure you or everyone here is aware of our senators. This is not like a big reveal, but Senator Mitch McConnell and Senator Rand Paul need to hear from us just like every month, because of course we live in a representative democracy and people cannot represent us if we do not tell them how. So we must tell them how and call them and say, please pass this bill. And then also pass a better one with triggers to make sure that anytime we have crisis, we have a solution. Because things like this will happen again, and Eastern Kentucky will flood forever because we have ruined the mountains and taken the tops off and put the dirt in weird places and done lots of things to create this situation. And so we need to be ready to deal with it when it happens. Just my extra processing their panics is, do they need to file their 2020 taxes to get the 600? No, Ben, it's the 2019 taxes. Sorry, I said the wrong number. It's 2019 taxes. They actually had the 2019 taxes. I haven't filed my 2020 taxes yet. We have until April. Come on, that has not changed. Sorry for any confusion there. But it is true that you can base, your eligibility can be based off of either. And there is some clear, if you want to pull up the committee text, they did a really good job in the Ways and Means Committee of explaining that this is supposed to be consumer friendly, and that even if you're eligible for even a partial payment based on your 2020, but not under 2019, that you will still get that money and you can ask for it after you file your 2020. So they're not penalizing you if you haven't yet filed your 2020 taxes, if that made you eligible, because obviously the pandemic affected a lot of people in 2020. So they did a really good job of spelling that out. So hopefully that will be functional and the IRS and the Treasury figure out how to make that work. But none of this will happen if the Senate doesn't pass it. So get on the phone, make the call. The Senate has to pass this. And it hopefully will. So it's even feels extra worth making that call. Sometimes I feel like I'm calling knowing it's not going to happen, but this one is you can feel a little better about it. I think it will, but we still got to make those phone calls. And I'm going to hand this off and then come to that chat, and I'll do my best to answer because I spent a lot of the weekend reading this very long bill.
It is very long. That's true. I'm Dustin Pugel. I'm the Senior Policy Analyst with the Kentucky Center for Economic Policy, which is a nonpartisan nonprofit research group out of Berea. And I'm going to talk a little bit about the economic overview, just so we kind of have a grounding for why all of these safety net programs are so important, why these added benefits around COVID are really critical right now, and then talk a little bit more later on about what still needs to happen. I'll just sort of back up Karen, everything she said. I think there's been some discussion about, is this package too big? Are we in a situation where we're going to overheat the economy and people don't actually need this? I mean, we're in a situation right now where 36% of Kentucky adults say they can't pay all their bills, where 1 in 4 parents are saying that they don't have enough food to feed their kids. We know that there's hundreds of millions of dollars in back past due rent because people have lost their jobs. And so I think really the question is, are we going big enough? And so it's really important, I think, as we're having these conversations around this new COVID package, just realize how important this is for so many people who are still struggling in a very, very real way, which is what I'm going to talk about a little bit. So just to start off, I think it's important, like I said, for us to just kind of get our bearings on what has been happening with jobs. The latest job numbers we have for Kentucky are from December, and they were not good. December was the first month since April that we had negative jobs in Kentucky. So we actually lost about 9,100 jobs that month. And that puts us at about 113,000 jobs fewer than where we started in February 2020. So a little over a year ago now. Now, we did bounce back considerably when we sort of hit bottom in April of last year, but that tapered off very soon after the extra unemployment money, what's called pandemic unemployment compensation ran out, and also as a lot of the stimulus check money had been spent. Now that, it sort of stabilized as some economic activity came back, but in December, right before a lot of the second round of stimulus checks hit people's bank accounts, and right before the new pandemic unemployment compensation program came into play, we actually lost ground. And so, we're still, like I said, a lot of folks don't have employment right now, and that's causing a lot of trouble for their family, but also for our broader economy. So let's move on to the next slide. And I think it's also really important to say that the pandemic and the subsequent downturn hasn't fallen on Kentuckians equitably. It has been worse for Black Kentucky workers and women in Kentucky. There has been really interesting data out about how poorly the job market has been serving women over the last year. In Kentucky, December was the first month when we saw there were actually more women claimants for unemployment insurance than there were men. Historically, it's a pretty significant larger share of unemployment claimants who are men, just because of the nature of work that they're in. There's a lot of seasonal unemployment for trades like construction and other male-dominated employers. But in this downturn, it's been more service economy workers, which is more dominated by women workers. And so we've seen really a pretty unprecedented situation there. Unfortunately, we're also seeing a very precedented situation, which is that Black workers have been laid off disproportionately high, which is typically the case in a downturn. And it's also been true that it's taken longer for Black workers to get work after the fact. White workers have been hired at a faster pace. So, I think as we continue to talk about why the safety net is important and how we ensure that we have an equitable recovery, these numbers are really important to keep in touch with and understand so that we can target programs for that purpose. So let's move to the next slide. It's also true that not only has it been harder on Black workers and women, but it's been much harder on low-wage workers. So jobs that underpay, that don't pay enough, and in this case, breaking at $27,000 a year, they're still 17% below where they were in January of 2020. The total is about 9% below where they were in 2020. But if you're a high-wage worker, things are pretty much the same as they were a year ago. There was a temporary dip in employment for high-wage earners in Kentucky, but since then it's basically been business as usual. So, this is a pandemic that has really fallen hardest on the folks who have the least to be able to get by on, and it'll probably take longer for them to get back to normal or something close to normal, which was never good enough, than it will be for others. So let's move to the next slide. We'll talk a little bit about unemployment insurance. So as folks know, I'm sure unemployment insurance is an insurance program. It's paid through employer contributions into a trust fund. And in Kentucky and across the country, we've actually had multiple different types of unemployment programs. So the one I just described is what you might call regular state unemployment insurance. There are these other programs called pandemic unemployment assistance, which I think folks are probably familiar with by now. That's specifically a federally funded program that helps pay for gig workers, independent contractors, small business owners, anyone who doesn't have an employer who's paying into the trust fund. And that is a program that has not been taken up nearly as high in Kentucky as unemployment insurance, but in the last just several weeks, PUA claims in Kentucky have really exploded. We went from, a couple thousand claims a week to over 70,000 claims a week a couple weeks ago, and it dropped down to about 57,000 claims last week, which is really, like I said, unprecedented. We've never seen that many PUA claims before. We've never had that number of sort of independent contractors and small business owners saying that they've lost work. So this is a really, I think, telling moment in the course of our recovery that, we're not out of the woods yet. And so there's still a lot of need for assistance, especially for folks who are, they don't have much of a safety net, like I said. And it's also important to say that if this federal program didn't exist, if they hadn't moved quickly last March to create this, these folks would be completely out of income. They would have nothing. And so I think it's really, we don't really give enough credence to some of the programs that we have done and their effectiveness. And I think this is an important thing to point out. The other federal program I'll just mention quickly here is the Pandemic Emergency Unemployment Compensation Program, which is an extra several weeks for folks who have exhausted regular state unemployment insurance benefits. And that number is held relatively steady at around between 35 and 37,000. And that could be a good thing or could be a bad thing, depending on, if that means that folks are getting jobs or if it means that they're just timing out on PEUC as well. So let's move on to the next slide. So yet again, we are facing a cliff for these special federal benefits. Instead of, like Kara said, making sure that we have automatic triggers that ensure that these programs are available when times are tough, we've instead just decided to keep pushing the deadline further out, in increments. So in December, when we passed a short-term COVID bill, which was explicit, they said this is just to get us through to the Biden administration when they can develop a new plan. We set the new deadline for March 14th. And if anybody looked at their calendar today, you'll know that that is 2 very short weeks out from now. It'll actually probably be a little earlier than the 14th based on the way it'll be the 13th because our weeks of unemployment end on Saturdays, not on Sundays. So when that happens, if this extra COVID bill, the American Rescue Plan, isn't passed, then everybody who's on PUA are going to lose their benefits. Everyone who's on PEUC is going to lose their benefits. Everyone receiving PUC, which is the extra $300 a week, they're going to lose that extra income, which is really critical in working toward keeping people whole as they've lost their jobs. And so, like, we're in a precarious position right now. It's also true that when we wait too long, when Congress has waited too long to pass these, even if it's just before the deadline, there's still often a gap because it takes so long for Kentucky to update our antiquated computer system to take into effect these new programs. So if the American Rescue Plan passes, then we end up with... Can you hear me at all? Stephanie?
Okay.
Yeah, okay. Sorry. I thought you might have had a question. So if the American Rescue Plan passes, then that means that we have yet another cliff we're facing, but at least it's several months out. So if this passes, then we have PUA and PEUC through August 29th. We also have PUC, the extra $300. It'll actually get bumped up to an extra $400 a week, and that'll be extended also through August 29th. So let's move on to the next slide. So just real quickly, I mentioned earlier that regular state UI benefits are paid through an employer contribution into a pot of money called the trust fund, the Unemployment Insurance Trust Fund. There's a lot of conversation about this happening in Frankfurt right now because like I think 18 other states, 19 if you include, I think it was DC, we had to borrow in order to continue to make those benefits. we had only just reached an account balance of 0 in 2015 because we had actually borrowed during the Great Recession as well. And so we had been building up since 2015, 2016. We had gotten to $600 million, and then we had to start paying out benefits. So we asked the federal government to extend a line of credit of up to $865 million. So far, we've borrowed around $500 million. So I think that's a, it's something that we have to do from time to time in order to keep people whole. But what that does is it actually triggers an increase in employer contributions. Now, if you've listened to the rhetoric in Frankfurt, you will think that that will be a massive, enormous, crippling increase in employer contributions that could just put businesses under. The truth of the matter is that these increases are very small. So if you look at this graph, you might notice that there are some blue dots, some like dark blue dots and some light blue dots there on the side. That's a representation of how much this will increase. So if you're thinking about it as a percent of total sales, it'll be not 0.5%, but 1/20% increase. And if you look at as a percent of total wages that are paid, it'll be about 1/3% increase. So this is a very small amount of money, and it comes in 3 different ways. We don't have to get into that here, but we're talking about increases per employee by maybe a couple $100, not thousands of dollars per year, not per month, per year. So if we want to make sure that we get to a place where we have a solvent trust fund in the future, we need to make sure that we're making those payments and not freezing them, not reducing them right now. We need to make sure that we're in a strong position later on to be able to do that. And even better, we should change the way that we target these so that we're aiming towards solvency, which is not the way we do it right now. We want to make sure we have a trust fund that can pay out benefits when times are tough. And that's sort of not the way that we have structured our employer contributions. So let's move to the next slide, and then I will wrap up. So just to throw it out here, I know that we're going to send out the slides later, so I'm not going to get into many of these right here, but I included links if you all want to look at the current bills that are out. There is Senate Bill 7. It's the only Senate bill that I've seen so far that deals with unemployment insurance. It's sponsored by David Givens. It's a really important bill that needs to pass. And I say that because there is a provision in it that allows folks to ask for essentially a waiver of overpayments. We were telling folks for a while, mistakenly, based off of some bad guidance from the Department of Labor, that they were eligible for pandemic unemployment assistance. We awarded them those benefits, and then we found out after the fact that indeed we were not supposed to give those benefits to them, and the federal government said we need that money back. So we need this bill to basically allow us to say, never mind, you don't have to pay it back. That was our bad, not yours. And there's several other bills in here, most of them fairly good. There's a couple that I'm concerned about. I'm happy to get into that in the chat if you all are interested. But I've already taken up a lot of time, and I feel like I should go ahead and hand it over. So with that, I'm going to hand it over to Adrienne.
Hi, everyone. It's good to be with you today. Next slide. Okay, so going along with the theme of a lot happening over the weekend, we got some interesting news Friday night about a federal court in Texas that ruled that the CDC order on evictions is unconstitutional. So this is one judge's opinion. So I want to make that really clear. The CDC's order still stands. It puts everything in flux, and we're afraid of the chilling effect that renters may feel less secure, and that landlords may go ahead and file for evictions that should not be filed. But there is some legal analysis going on, and I'm happy to put that in the chat. But yeah, super exciting. At the state level, there are a couple of bills that I want to flag for your attention. One is SB 264 filed by Senator West. It just removes the governor's ability to declare an eviction moratorium under KRS 39A. That is the chapter that gives the governor his or her executive powers under an emergency that has been continually attacked during this General Assembly. And then the third column talks about HB 570 that was filed by Representative David Mead, which also removes the governor's ability to declare a moratorium, this time using KRS 383, which is our landlord-tenant chapter. And then it creates a small pool of emergency rental assistance, about $5 million. But as Dustin has said, as we all know, the amount of back rent that Kentuckians owe is much, much larger than that. Next slide. Okay, so just as a refresher, the CDC eviction order for non-payment of rent was issued on September 4th. It is good through March 31st. And it is our position that it needs to be strengthened, that there needs to be an enforcement mechanism during the legislative process that's going on right now, because Congress is using budget reconciliation. It needs to happen separately outside of the American Rescue Plan Act. Next slide. Okay, also a refresher, because unfortunately people still need this information, is that Kentucky Equal Justice Center has put together homerenterdeclaration.org. It can still be invoked, it can be used in Kentucky, it can be used in Virginia, it can be used nationwide. And so we encourage folks who are impacted by loss of income to visit that and get their declarations in. Next slide. Okay, so throughout all of this, we've tracked the 211 calls, and we know that of all the 211 calls in the Metro United Way system, 31% remain for housing and shelter. And of the housing and shelter requests, those have increased to 70%, up from last month for rent assistance. We know that the emergency rental assistance that is now available is very much needed. Next slide. Oh, hey, Ben Carter did what I was going to do in the chat. Thank you, Ben. All right. So there is rent assistance, and it is available in all Kentucky counties. So statewide, all counties minus Fayette and Jefferson, go to the link that is the Team KY HHERF and some other letters. And then if someone's eviction has gone through, unfortunately, they are homeless or displaced, contact us. We're building, we've got some resources available from Kentucky Housing Corporation, but we're in the process of making that all consolidated and transparent so people know where to go to for assistance. In Lexington, you can go to Lexington Fayette Urban County Government's website, basically, how do I get help? And then in Louisville, the application portal for their pot of rental assistance is stopmyeviction.org. The other thing too, I want to highlight with this emergency rental assistance is that it can cover utility payments, like all of your utility payments except for trash and broadband. And all of, instead of going to your community action agency or going here, going there, it can all be processed in that portal. Next slide. Okay. So Kara had referenced the American Rescue Plan Act, and I just wanted to cover the housing provisions in it. There is $26.1 billion in rental assistance that is in the House's plan. About $20 billion of it goes to emergency rental assistance, more of the program that I was just talking about. $5 billion is in additional emergency housing vouchers where people can find a place to live and their rent is paid for. And then $100 million in tribal and rural housing initiatives. So I'm very excited about that. An additional $5 billion in homeless assistance. We know that in the CARES Act, there was a significant amount of homeless assistance dollars made available. And those have been deployed. There was a slow rollout among HUD, within HUD. But we also know that a lot of communities are struggling to shelter people safely. Communities that may have had room in the inn models before, or warming centers just aren't able to do that. So we feel this is very, very, very much needed. An additional $10 billion in homeowner assistance for people who are in default with their mortgages. And finally, $120 million in housing counseling and fair housing initiatives. Okay. I will get to all of these awesome questions in the chat. I think I'm almost done with my slides because these are good questions. Okay, so in the meantime, we do want to continue to hear from Kentuckians. Kentucky Voices for Health and HHCK have joined together to bring on Katie Mueller, who is known to many of you. She is our story banking coordinator. She'll be working with both organizations and people across the state to share stories of housing and health. And so her email is at the bottom of the slide. It is kmueller@hhck.org. Okay. And our calls to action that we would urge you to take. There is an organizational sign-on letter to the Biden administration about the eviction moratorium or the eviction order. We know where it's for non-payment of rent only that a ton of evictions are still going through for other lease violations, when leases terminate, that sort of thing. So the whole thing, it just needs to be improved. Please add your organization. So far, we have about 9 or 10 organizations from Kentucky who have signed on, and I know there are way more organizations who care about this issue than that. And then as Kara said earlier, tell Senator McConnell and Senator Paul to vote for the American Rescue Plan Act. Okay, thanks, bye. Okay.
Adrienne, we didn't even plan that. We didn't even plan that we were both going to say the same thing. How did that happen?
No, I know, because we are that in sync. With that, I'm going to turn it over to Tyler Offerman to talk about PEBT.
Hello all, my name is Tyler Offerman. I work with the Kentucky Equal Justice Center and I work on food nutrition policy. We're going to be touching base on SNAP and PEBT. First off, just as we show every time we do this, a trajectory of SNAP usage in Kentucky going back the past 15 years or so. As you'll see, big uptick once the pandemic hit and a lot of the shutdowns started, but did want to point out that we are still not near where we were at sort of the height of the fallout from the Great Recession. And some recent data that I've seen suggests that there's even more food insecurity in Kentucky now than there was during that time. So while I think it's great that SNAP usage has ticked up during this pandemic, that's the point of this program, to ensure that when we fall into a situation where we are hungry, that we have access to food. But I do also know that there's a lot of folks who could be qualifying right now for SNAP in Kentucky that are not signing up for whatever reason. So I urge either you to sign up if you're eligible or to work to make sure that folks do sign up, because a number of things have changed over the past couple of years when it comes to eligibility. There's more eligibility right now in Kentucky than there used to be. Another big point I wanted to point out, folks may have remembered that after the CARES Act, the unemployment benefits that folks got counted against them for SNAP. So the $400 in PUC that Dustin mentioned earlier, that additional bit on top of whatever UI you get, no longer counts as income. So maybe you were disqualified when you applied earlier in the pandemic. There's a chance you might qualify now. So urge you to go to the cabinet website or connect.ky.gov to check your eligibility. Go to the next slide. Real quick, one thing I do want to say, I got the deadline confused for when I was supposed to update my slides. So there's a couple things I will just be adding that I meant to include. That's my mistake, but in the slides we do send out, that information will be included. So just a couple more quick things on SNAP. The 15% increase does currently go until June. As Kara mentioned earlier, we do want Congress to extend that. Those benefits have been kept real low for a long time. They should be increased. The emergency SNAP benefits, sometimes called max allotments, have been approved for March. There's a small wrinkle in the max allotments that I don't need to get too far into, But when we were talking about reaching out to our legislators to make sure that they defend the safety net, it's really important now. A bill that the General Assembly passed back in January, Senate Bill 1, which would revoke some of the governor's emergency orders. That bill, because the max allotments require both a state of emergency and a federal state of emergency, Senate Bill 1, if it is fully implemented, right now the governor had sued and it's in the courts. I don't know how that process will go. But there's a chance that if the General Assembly strikes down the governor's state of emergency and they do not pass one in its place, that we might lose max allotments starting in April. I have no idea if that's going to happen. We will obviously update you if it does, but it's something we're keeping an eye on. And then there's several waivers that we've gotten around SNAP and WIC that are still in place, making sure that folks can access those benefits remotely and with the least amount of barriers as possible. All right, so we can go to the next slide. PEBT, it's long awaited. You'll see down there where it says information needed. That's one of the glitches from my tardiness. I apologize. But PEBT, so the state had applied for PEBT some time ago. The state and the feds went back and forth, and we finally got that guidance at the end of last week. So for those that don't know, PEBT, pandemic EBT, is meant to replace meals that children miss because of school closures. So in order to be eligible, your child has to be participating in the National School Lunch Program or be at a school that has what's called community eligibility, which means there's enough children on free and reduced lunch at that school that everyone at the school qualifies. So the amounts, so folks might remember the amounts that went out in August and September. So this plan that the state got approved will carry us from October all the way through May, but there's sort of two different buckets, right? So there's the benefits you are owed from October through February, and then there's the process moving forward, so March through the end of the school year. For the amount that you'll be getting for October through February depends on if you were fully remote or if you were in a hybrid. There will be I know an FAQ that the cabinet will release soon. I'm trying to convey as much of that information as possible, but I would just send you the direct link, but it's not up yet, the way that they actually calculate this. But you will either get the 136.40 or the 81.84, depending on which of those two scenarios you were in. Now for March through May, the cabinet will actually be doing a census of all the school districts to figure out how many days they are doing in-person versus remote. And the amounts that you'll be getting moving forward will vary depending on the school district. That might be confusing. You know, my friend lives just 10 minutes away and they got a different amount, but that might just happen because it's based on school district. Now the piece where it says information needed, there is no application process. I'm about to go into how you'll be getting your benefits, but just some information you need to have handy. Obviously, the student's name, date of birth, and then their state student ID number. That should be all the information you will need. So let's go to the next slide. Great. So the cabinet will begin issuing benefits retroactively starting the week of March 15th. They don't have an exact day yet, but it'll be right around then. And the way that it'll happen is they will issue your back due benefits every week until you're caught up. So the amount that you should have gotten in October will come out the week of March 15th. That'll either be 136.40 or 81.84. And then for November, March 22nd, December, March 29th, so on and so on. Now, once you get caught up, your March benefits would be issued April 25th, your April benefits May 25th, and so on until the school year ends. So real quick, there is a new process to contest or decline benefits. If you are in a situation where you feel like you don't need PEBT, you can decline your benefits. You can do that by calling the DCBS number that's at the very bottom. You'll hear me say this number a lot, 855-306-8959. Also, if you get the 8184, the hybrid amount, but you think you should be getting more than that, say your child was fully virtual and you get a hybrid amount, you can contest that by, again, calling 1-855-306-8959 and basically making your case. Now, when I said the information you may need, that's, you'll need to obviously prove with the student ID's number, name, date of birth. Another quick piece. So there has obviously been some confusion in the past about foster and kinship care households. The cabinet will be sending the any new cards, and I'll get to who that will affect, but they'll be sending any new cards to the address that's on file, right? So if your child has recently become a dependent of you, moved into your household, and you are providing them care, fixing meals for them, then you should notify the school district first that change has happened. And, obviously, if the card gets sent to their biological parent or whoever, and they spend that amount, then that money is gone. So you'll need to make sure that if you are caring for a child, either in a foster, kinship care, or another arrangement, you should be able to get the benefits for them. You just need to make sure that the cabinet has your address. And when I say the school district and the cabinet, the reason why I say that is because the card will be sent, but then, if another parent or another guardian contests it, that process really just is, and I hate to say this, it's sort of a first come, first serve. Like whichever guardian contacts the cabinet and says, I am caring for them, and that card is sent to them, at that point, the card is sent. And it's really not possible for you to contest that. So I'm happy to answer questions. I know there's a lot, but just moving right along. How will the benefits actually be received? This is, I'm sure, what you really want to know. If you're in a SNAP household, the benefits will automatically be loaded to your EBT card. And again, they'll be loaded based on that calendar. If your child got a PBT card in August or September, similar to the SNAP household, it'll just be automatically loaded onto that card. Now, if you got August or September PBT card, but you don't still have it, it was lost, it was destroyed, there are two numbers you'll call, one depending on your situation. If you have the same address, as in the child has the same address, you'll just call the people that actually make the card, easy peasy, they'll just reissue it. Now, if the address has changed, and this is particular of note for foster and kinship care folks, if your address has changed, then you need to actually call the cabinet, because the card manufacturer has to go by what's on file. And if you need to change what's on file, then you need to call the cabinet. Now, when I mentioned cards being sent out automatically, the only people that will receive cards sent to them who are not in these categories that I just mentioned are folks whose children started to participate in the free and reduced lunch program after August and September. So your child aged in, their circumstances changed. If they never received a PBT card, but they are now eligible, you will be automatically mailed a PEBT card. So I know that was a lot of information, but I'll jump into the chat and answer as many questions as I can. Just one other thing, as folks might remember, there were a number of students that were not eligible for PEBT, and that continues. So traditionally homeschooled, students in military boarding schools, you're at a school that doesn't participate in free and reduced lunch. But now the difference is if your child was enrolled in all in-person classes, then obviously they also would not qualify. So with that, I think I can go ahead and hand it off, and I'll dive into the questions and start answering what I can.
Thank you, Tyler. Hi, I'm Priscilla Easterling. I am the Outreach Coordinator for Kentucky Voices for Health, and I will be talking about some of the important health updates and a very, very cool, exciting opportunity of a new special enrollment period. Next slide, please. So just a couple of reminders, the public health state of emergency was extended until April 20th. It runs January 21st through April 20th. And part of what's really great about that, it extends that enhanced federal matching for Kentucky, which helps offset state dollars. And it also extends important waivers that are related to providing care. Medicaid, there still should be $0 co-pays for Kentuckians and an MCO, dollar co-pays for fee-for-service. That part hasn't changed. Just a reminder that there is one universal formulary for Kentucky, although there is a little bit of a caveat to that I'll go into a little bit later. And a very important thing, just a reminder, Nco Selection Period is extended until March 15th. So the deadline is like 2 weeks from now. If you are currently enrolled in an MCO and you want to change your plan, check it out. Now is the time. One of the really cool bills that is sort of making progress, it's in the House right now, is SB 55, which would prohibit any form of cost sharing for co-pays and Medicaid, any form of cost sharing for Medicaid and K-CHIP, which is very important. Next slide, please. In general, the rest of it hasn't really changed, but the exciting news. So the special enrollment period for healthcare.gov, this was opened, this began February 15th and will run through May 15th. The Biden-Harris administration opened this as an opportunity for more Americans to get covered during a global pandemic, which is kind of important to have health coverage right then. So the special enrollment period is awesome, especially because, I love saying that word, it's awesome right now because you don't have to provide any proof or documentation of a life change, which is normally the case. And it also gives consumers up to 30 days after they submit their application. They can choose a plan. They're online on the healthcare.gov. There is a whole platform so that you can shop different plans, look and compare and see what's going to really work for you. And one of the other special things about this enrollment period is that current enrollees can change to any available plan in their area without restriction. That's not always the case. That's something that they rolled back because of the pandemic. And we're still sort of waiting on on guidance about how the subsidies will be adjusted once that federal relief bill will be passed through the Senate, but it's expected to be retroactive to increase the subsidy payments so that your monthly premiums are much lower and your out-of-pocket costs are more affordable. Next slide, please. Okay, and as I mentioned, the deadline to change MCOs is March 15th, 2 weeks from now. So if you are currently enrolled in MCO and you want to check it out, you want to change, you're not sure you want to, just go look. Here's the little comparison guide, and you can check out the different bonus benefits and services that each MCO offers. Next slide. Okay, so for 2021, these are all the changes that have been made since January. Some of this is still, hasn't really changed in the last month or so, but just friendly reminders. So all Medicaid members who are currently enrolled in regular coverage have, again, March 15th. That is the deadline. I just want to make sure that y'all know that. If you want to change it, now is the time. Any new Medicaid enrollee, if you do not select an MCO when you do your application, you'll automatically be enrolled in United Healthcare. That is going to be the rule for this year, as far as we know. And any Kentuckian under the age of 65 with a household income of less than 138% of that federal poverty line, for an individual, that's about $17,600. For a family of 4, that's about $36,000, plus a couple bucks. You should apply for Medicaid at any time during the year. You will be eligible. It's always a great idea, and you can do that on Connect. For temporary Medicaid, beginning January 1st, PE Medicaid began being covered by United Healthcare, which just became an MCO for Kentucky this year. Any Kentuckian who had PE at the end of December were automatically enrolled in United Healthcare a new PE period that ends at the end of this month, March 31st. So if you were one of those people who was automatically enrolled, you had coverage at the end of December, the DMS automatically enrolled you in PE coverage. That will end March 31st. And we highly, highly, adamantly encourage you to fill out a full Medicaid application before the end of that PE period. We're still sort of waiting on guidance from DMS about whether or not they'll allow 2 consecutive PE periods, but Kentucky receives more funding when more people are enrolled in full Medicaid. So if you're eligible for PE, you're more than likely eligible for Medicaid. You'll get better benefits. Just go ahead and fill out a Medicaid application. Okay, next slide, please. Okay, so for PE, just a couple of reminders. On January 30th, DMS, so all of the sort of relaxed rules that they had last year in 2020 because of the pandemic, they had to start rolling those back a little bit. So beginning January 30th, if you are over 65, or rather, if you're over 65, your income is above that eligibility requirements, or you have some other form of health coverage, you're no longer eligible for PE. If you, but one of the cool things, more than 140,000 Kentuckians are currently covered by PE, and just since January, more than 31,000 applications were completed through Connect, which is just incredible. Thankfully, the PE application, from everything we've heard, it's going to remain publicly available, which was not a thing before the pandemic. And currently, Kentucky allows for 2 PE periods within the calendar year. Like I said, we're still waiting on guidance about whether or not they'll allow 2 consecutive periods. But again, full Medicaid is much better. If you get into PE, if you're eligible for that, you're more than likely eligible for Medicaid. Just do the full application. You will get much, much. It's a full service thing. It's better coverage. Next slide, please. So the single formulary, as I mentioned earlier, Kentucky moved to a statewide universal formulary at the beginning of January. But one of the things that we have heard is that each MCO still does have a supplemental formulary for their preferred drug list. So you can check out each of those formularies to see if your drugs, the prescriptions that you like, are available through where they are on that formulary. And if you've had any problems, or anyone you know have had any problems getting a prescription filled, we're trying to collect some of those examples so that we can send those to DMS so that we can fix that issue. So if you or anyone you know has had that issue, definitely fill out that survey and share it with your network, share it with your friends, all of that. Next slide. Okay, and prior authorization updates. The current PA guidance has been extended through April 30th. There weren't any major changes since February 1st, but the big thing to remember really is that prior authorizations for substance use disorders, behavioral health services, all of that for medication-assisted treatments, all of that does not currently require a prior authorization. So again, if you had any problems with that, or anyone you know, or anyone in your network, definitely fill out that survey that was linked before, or contact us directly and just let us know what's going on. Next slide. So great news. I should have put great news instead of good. But so the Medicaid work requirements lawsuit was withdrawn by the Biden administration last week. Everyone is excited about this. Everyone is excited about it. It's wonderful news because it means that more people are able to maintain their coverage, keep their coverage, get covered through Medicaid without also having to prove that they're working or anything like that. So that has been withdrawn. That's no longer on the table. And in the American Rescue Plan that Kara mentioned earlier, and everyone so far has talked a little bit about, some of the health benefits that are included in that. So again, it was passed in the wee early hours on Saturday morning. It's now onto the Senate. They're hoping to pass it by March 14th. But some of the really key health benefits that are included in that, it would eliminate premiums for many low-income people and reduce it for a huge chunk of others. So Right now, it would be about, if you are less than 150% of that federal poverty line, you would more than likely pay $0 in your premium. If you're between 150% and 250%, you would pay a much smaller amount. The exact amount is still being negotiated because it hasn't passed the Senate, but there's a lot of relief to help make health insurance way more affordable, because that's one of the things that we always hear. You might be eligible for tax credits, might be in there you might be eligible based on your income, but the actual spending of it month after month, it can be a drain. That's what makes it unaffordable for people. So we're really excited about that relief being included in there. It would also protect marketplace enrollees from having to make subsidy repayments to the government. So typically what happens when you have the advanced tax credit, you get that every month, and at the end of every month when you're covered through the marketplace, and at the end of the year when you file your taxes, you have to reconcile that. And if your income ended up being higher than you initially reported on your application, you might have to pay back some of that subsidy. But one of the things that's included in this bill is that they would protect you from having to do that. So for most people who in 2020, which was a bonkers year, their income oscillated greatly. They might have lost a job at the beginning of the year, got a higher paying job at the end of the year. So one of the things that's included, you don't have to repay that tax credit back, which is awesome. And it would also offer subsidies to people who recently lost their jobs, which is not a thing before. You had to base your application on what your expected income was or is. If you had unemployment, you could count that, but for most people, it wasn't enough to be eligible for coverage. But now that is one of the things that's included in the relief bill. If you are receiving unemployment benefits, they would set your tax credit at the most favorable level to get you the max subsidies possible. And then the other thing, a lot of other things, but one of the other big things to highlight, it would also provide federal funding for COBRA coverage. So people who lose their health insurance and want to keep their work health insurance, typically it's quite unaffordable and most people can't keep their COBRA coverage, but this would provide federal funding to cover about 85% of that, which is dope. Next slide, please. So the Aca lawsuit, we've talked about this really since November. Nothing has happened yet, but we're just waiting for the decision, which we hear every week could be any week. So we're just waiting for that. Again, we're in a much better position now because assuming we have a much more favorable Senate and government and president who actually wants to expand affordable healthcare. So whatever the lawsuit is, Congress can fix it again by just setting the penalty at a single dollar. So we're not as worried, but we're still waiting for what the decision is. And as soon as we have that, we'll be sure to share that. Next slide. Yeah, that is it. So again, we're just waiting to hear that decision, and I'm happy to pass this over to Marcie.
Hello, I'm Marcie Timmerman. I'm the Executive Director of Mental Health America of Kentucky. Go ahead and change the slide. So we started talking this whole time about disasters, right? And the fact that we've got lots of problems happening in Kentucky. We have 2 pandemics of COVID and racial injustice. The horrifying events at the US Capitol in January are also additional mental health challenges. And then you add on all of these other things that happen in Kentucky on a regular basis, like floods. We're going to all be affected by behavioral health issues. Some of us more than others, but we need to acknowledge the toll that these tumultuous times are taking on both mental and physical health. Go ahead, next slide, please, Kelly. Thank you. So these are some feelings that people have expressed having during COVID-19 that folks don't realize are very normal right now. So stressed out, exhausted, panicked. I'm pretty sure we've all been all of these things, or maybe even all of them at once at times. Some of them are contradicting, but you can be them in the same hour, I'm promising. That doesn't necessarily mean you have a mental health issue, right? But if these kinds of problems are happening to you on a regular basis, very frequently, and interfering with your ability to work, to take care of your child, to take care of yourself, it is time to reach out to someone to get some help. And there are lots of ways to do that, and we'll share a resource slide here in just a second. Go ahead and next slide. There we go. Couple of ways to help take care of yourself though during this time. Look for opportunities to laugh, right? Have those moments. They can be really funny and they can be only funny to you. That is totally okay. Get enough sleep. Exercise is appropriate. Not everyone exercises the same way. Not everyone can exercise the way they want to and the way they always have. Find new ways, right? Do it what you can to your ability. On the get enough sleep, I want to backtrack for a second. Also get rest. That's not the same as sleep sometimes, right? Take that moment when you're feeling anxious and stressed out to take a rest. Take 5 minutes, do a breathing exercise, do a yoga pose, do whatever kind of thing makes you restful. Make sure you're investing in that a little bit of time. Set healthy boundaries. Know what you're willing to do and what you're able to do right now. And it's very different than it was a year ago. And that's okay. Be kind to yourself, though. Don't talk to yourself the way you wouldn't talk to a friend. That's really easy to say. It's very hard to do, to monitor your own thoughts and make sure that you're doing that, but make sure that you're being kind to yourself. And stay connected to folks. Stay connected to your loved ones, whether those are friends, family, or both. Make sure you're taking that time to do that. And, not just sitting in a chair and working all day. If you're working from home, that's easy to do and not a good idea. It goes back to that boundaries conversation. Next slide, please, Kelly. These are some resources that are always available. For local resources, including hotlines at your local community mental health center, go to our website at Get Help. You'll see all of them there. Suicide Prevention Lifeline, there is You Are Not Alone, and we want you here. So please feel free to call this 24/7. If you are a veteran, hit option 1 and you get the veteran crisis line. Crisis text line, if you don't want to call, you don't want to talk, it's okay. Text somebody. Text hello, text MHA, pretty much any word you text, you're going to get a response. If you are in the LGBT community and under the age of 40, Trevor is the best place for you to reach out to. They have folks who have walked your walk and been where you are. So make sure you have that number and information available. Feel free to take a screenshot, but of course you're also going to get the slides. Go ahead, Kelly, you're fine. So from a policy standpoint, the substance use disorder waiver for treatment during incarceration, we were talking about that. The General Assembly asked for them to start treating people for substance abuse while they're incarcerated and get it paid for by Medicaid. That's the different piece, right? They've been treating some people, but they can do more if they have a funding source like Medicaid. The waiver had a 30-day comment period in Kentucky. There was a 30-day federal comment period as well. Right now, we're in a holding pattern waiting for CMS to decide whether or not to approve that. We did get some information that the state is talking with the Administrative Office of Courts about administration and appropriate use of this additional option. So some of the concerns that we have, we're hoping are going to be taken care of with education from the AOC. Does anyone have any questions about that piece, though? We don't have a lot of the nuts and bolts details yet. All right, we'll skip to the next one. Telehealth services beyond COVID. Many of you already know the pandemic has brought the emergency of telehealth to the forefront for not just behavioral health, but for all health in a lot of ways. But they're effective and really popular. Our assembly is trying to make some of these changes permanent, telephonic only, not having to see the patient for a mental health treatment by phone. House Bill 140 has ended and is a comprehensive bill covering all types of telehealth platforms. Make sure that our reimbursement is equal as well, right? The equal amount of time, equal amount of effort put in should be reimbursed at the same rate. Hopefully we'll see House Bill 140 and a new telehealth world. It has been assigned to Senate Health and Welfare, so if you want to put any pressure on them, that'd be awesome. Go ahead, next slide, please. And I forgot to talk about 988. I forgot to put in a slide about that. I wanted to update everyone that federal government did pass 988. It will be a mental health hotline like 911 is. We did just receive funding at the state to help with the building out of that process here in Kentucky. So 988 is not live yet. You still want to use that national hotline I shared, but as soon as 988 is around, you'll hear all about it from all of us. So stay tuned. There may be some bills that we need to pass in order to get some more additional. And on to Emily.
Thanks, Marcie. I know that we're getting close to the end of time. I have a few resources I just want to make sure people are aware of. And some of these resources have already been shared or we've shared in past. Oh, Can we flip back? Are we back at, okay, thanks. Um, in terms of rental assistance, Adrian talked about some of these resources, but they're all here at the end of the slide deck. If you'd like to access these and share them with your networks, we can go to the next slide. Utility assistance, there's the link to apply through your local community action agency. I saw in the chat that some of the district area development, the area development districts also can provide some of this utility assistance, and we can try to find a link to that as well. Other resources that we've shared in the past include the ACLU Reentry Resource Guide, free mental health screenings, and the General Assembly Access Guide, which Sheila talked about, the temporary Medicaid application. And I actually want to stop and talk a little bit about what I've been seeing in the chat. I was just responding to one of the comments asking about whether or not PE coverage will be extended. As Priscilla was mentioning, PE coverage is meant to be temporary. It's the month that you apply and 2 months following that month. So it can be up to about 90 days. Typically, when we're not in a pandemic, it's limited to the month that you apply and the month following. So about 60 days. But right now, they've extended it to about a 90-day period, depending on what time of the month you apply. And there are these 2 periods that people can be eligible for within a calendar year. We're not sure if they can be used back to back yet or not, but we will get that information soon. And as far as extending it further, what we know now is that people are really being encouraged just to apply for full Medicaid if you're eligible. If you're not eligible and your income is above 138% of the federal poverty level, or if you're over the age of 65, or 65 or older, really, then you won't be eligible for PE coverage either. So it's really important, if you fall into those categories, to make sure that you're shopping on the healthcare.gov marketplace and looking at those options and the subsidies that might be available to you. So you can also see here links to connect. There's great information there about a number of resources, and United Way has been expanding across the state. So a link to all of the areas that United Way now covers. Let's go to the next slide. I think that we've mentioned the Medicaid and SNAP tracker and even the COVID-19 tracker at various times during our presentations. They always live here at the end of our slide decks. In case you want to access those, there's great data on all of these trackers. And that's really thanks to our friends at KY Policy. Let's go to the next slide. Here you can see a list of the legal aid programs that exist around the state if you need assistance. And we had some conversation in the chat earlier about stimulus checks. For people who don't file taxes, there is an IRS tool for non-filers. You can enter in some pretty basic information to get that check. And then there's also assistance through VITA sites. And VITA sites are those that assist people in preparing tax returns. We can go to the next slide. Here are some resources for food assistance, and I know Tyler mentioned some of these, but this is another set of resources that kind of exist at the end of all of our slide decks. We can go to the next slide. And Adrian mentioned our story banking project, and we're super excited to have Katie Mueller on board, helping us to collect the experiences that people are having with healthcare and with housing, and sometimes with healthcare and housing. We know that housing is essential to people's health, which is why we wanted to partner with the Homeless and Housing Coalition. So if you're interested in talking with us about your experience with housing, healthcare, or both, or if you know people who may want to share their experience, please contact Katie. We have some beautiful videos that we've created in the past few months, and you may have seen them on our social media. If you haven't had a chance to see them yet, you can go to our social media page, KY Voices for Health, on Facebook or on Twitter. You can see these videos and get a sense of what we're doing with people's stories. And then I just want to make sure everyone has the dates for our upcoming webinars. Our monthly advocacy series, that's what we're doing right now, our state and federal policy updates. Those are most months on Tuesdays at 2 o'clock. You can see the dates here. On every quarter, we have a forum with ThriveKY and the Cabinet for Health and Family Services. And so the dates for those forums are here as well. So always Tuesdays at 2 o'clock, unless we're in the middle of a legislative session, and that's why we've had the last two on a Monday. So I appreciate that everyone is able to join us today when it's not our regular schedule. And then, and something else that lives in perpetuity in our slide deck is Sheila's excellent advocacy training. It's a great resource. So I think that's it. Let's go to the next slide. Oh, just a reminder, again, if you are a licensed social worker or a certified community health worker and you need a CEU certificate, you can email Kelly for that. And I think our email is working again. So hopefully we'll receive that email and be able to respond to you. I'm sorry if we missed any emails earlier today. And let's just go to the next slide, Kelly. Here is our contact information. And like I said, all of this will go out tomorrow, the slide deck, the recording, and some of the links that we shared today. I'll also put all of the chat in our email update because I think that it was really useful information and could be a good resource for y'all too. So with that, unless we have any last minute questions, I think we are ready to wrap up. So thanks again, everyone, and I hope you can join us next month.